For patients with severe hip conditions that are no longer responsive to conservative measures, hip replacement is an excellent option. The goal is to return to a more active and less painful life. Many patients here in the desert have a goal of returning to any of the 3 Gs: golf, gardening, and grandkids. Oh, and now pickleball too. But there are a few things to keep in mind during the recovery with regard to the most common complications. Thankfully, these complications are not very common. They include infection, dislocation, leg length difference, periprosthetic fracture, and nerve injury. We do everything we can to avoid infection, including using a strong soap for bathing prior to surgery, antibiotics around the time of surgery, and occasionally we continue preventative oral antibiotics for higher risk patients. Thankfully, nerve injury is fairly uncommon, but we are working closely to the sciatic nerve during surgery. With patients with concomitant low back degenerative disc disease, this risk may be higher. The most common nerve injury experienced after hip replacement is a foot drop. Periprosthetic fracture refers to a fracture of the bone that is supporting the hip replacement implants. For the first couple weeks after surgery, we recommend no high-impact activities with an avoidance of twisting and pivoting on the operative extremity. If there is a persistent limp or any doubt with regard to your balance or strength, we would recommend continuing to use the assistive walking device until it is no longer necessary. This may be a matter of days, weeks, or months depending on the patient. Finally, the risk of dislocation and leg length difference may be somewhat minimized with the use of robotic assistance. This ensures the most optimal implant position and restoration of accurate leg lengths. To avoid dislocation, we often refer to hip precautions, but in general, focus on keeping your knees out, and this is generally a position of stability for your hip. Although not common, if a leg length difference is present post-operatively, this is fairly easily remedied with a small heel lift insert inside the shoe. By avoiding these complications, we hope to get you out enjoying those 3 Gs as quickly as possible.